We're here today with Dr. Luke Peterson, a doctor at Banner University Medical Center Phoenix Addiction Recovery Center. Dr. Peterson, can you go ahead and walk me through the process of an expecting mother coming in here looking to get some sort of treatment for her opioid addiction?
First of all, it's a really courageous and really difficult thing to do, to ask for help during pregnancy. Expecting mothers who have a substance use history or a opioid use disorder are marginalized. When a mom comes in to see me, the first thing I do is I just welcome her here because it takes so much courage to ask for help. The second thing is we find out what the mom's history is. What are they currently using? Does she have a home? We ask about the history of other mental illnesses and other medical conditions. We offer a gamut of blood testing for bloodborne pathogens, especially if someone is using intravenously. And then we talk about the treatment options, which for opioid use disorder include medication-assisted treatment, so medications in conjunction with behavioral treatments.
Now, what would you say to a mother who comes in and says, Dr. Peterson, I'm scared. I'm scared to get on MAT.
I would like to find out why she's scared. What is it about being on buprenorphine or methadone that is making her worried? We find that lots of times people are nervous that being on methadone or buprenorphine is a black mark for the Department of Child Safety. And so we reassure these moms that this is not a black mark. Being on these medications is part of the treatment, and that you can have a healthy pregnancy, and that you can have a healthy baby, and you can parent your baby when you're on these medications.
Okay, and why can't they just go cold turkey? Why can't they just quit?
So we recommend not going cold turkey, not doing a, quote, detox, because the rates of return to use are so high, and we worry about the withdrawal that happens from cold turkey causing pregnancy complications. So when mothers are actively using, there's periods of time where they're using and there's periods of times when they're in withdrawal. And that cycle back between use and withdrawal, that does have clinical impact on the pregnancy. We see smaller babies, we see more complications with the pregnancy itself, to the point that you don't actually have lower rates of NAS in moms who do go cold turkey because of the high rates of returning to use. When we stabilize moms on buprenorphine or methadone during their pregnancy, those complication rates dramatically decrease, such that they can have a very healthy pregnancy as opposed to having some of these other side effects.
So for a patient who wants to come to this office and seek treatment, what's the process like?
There's really no wrong door to enter into our clinic. You can go to the hospital, you can go to the OB floor, you can go to your OB's office and get a referral here. You can see your primary care physician and get a referral. You can cold call our office and get an appointment as well. Opioid use disorder and other substance use disorders are chronic illnesses. They don't go away with pregnancy. They can oftentimes we manage them, but these are things that ought to be managed long term. And so what we often see is that after the baby's delivered and life is changing and things are stressful, there is a significant return to use after pregnancy. And for a long time, we have been really focused on the baby when the baby's in the body, but we can't stop when the baby's delivered, because whatever effect that substance use has on pregnancy it pales into comparison to the effect that a using mother or father has on a developing child. And so we need to focus on the pregnancy, but we need to extend that longitudinally and follow these moms and these parents long term.
So, doctor, can you take us a little bit behind the stigma of MAT?
So probably the top stigma is, doctor, aren't you just changing one drug for another?
Right.
And I guess included in that is you can't be sober on MAT. And when I am talking to patients and also other clinicians and community members about this, the question that we need to answer is, what is addiction? Physiologic dependence is not in and of itself an addiction. Just like if I removed somebody's blood pressure medications, their blood pressures would rebound. they're not addicted to their blood pressure medications, and yet it is okay for them to be on it, even though they're physiologically dependent on it. My question then to people is, why is it not okay for you to be on MAT and be physiologically dependent on it, but like resolving all these other maladaptive behaviors and things that are going on in their life? And so in the strict definition of addiction, you could be on MAT and not addicted to it. So that being said, you can have a patient on medication-assisted treatment, either buprenorphine or methadone, that we now see those addictive behaviors go away. And they're actually doing what I would say are behaviors of recovery. They're parenting, they're goal-oriented, they're taking the medications as prescribed, they're not having any maladaptive behaviors, they're not using the medicines in a compulsory way, they're not craving, they're not continuing the medicines despite negative consequences, and they're not addicted, or they don't have an opioid use disorder despite being on an opioid. We're seeing behaviors of recovery. Yeah, there's a medication in their system that if you remove it, they'll go through withdrawal. There's physiologic dependence still, but physiologic dependence is not in and of itself an addiction. I would say that methadone and buprenorphine will, more than anything else, help moms to reach their goal of a healthy pregnancy, a healthy baby, and parenting their kid.
That was great. Thank you so much for being so thorough, doctor.